Let the dogs out at Dog Dynasty. Welcome, I'm Jack Bowen. How to keep our dog's vision at its best? We'll ask dog eye doctor / surgeon, animal ophthalmologist, Dr. Jeff Studer. Jeff, what problems should we watch for in our dog's eyes?
Biggest thing that you can do as an owner is be very cognizant of potential problems and act fast on them, because eye issues can progress very, very rapidly. For instance, the things that I always recommend people watch for in any normal dog, and I watch for the same things in my dog: squinting. If they're telling you, hey, my eye hurts, that's something to not ignore. Redness on the top of the white of the eye, that's a good marker that, hey, something's going on here. It may be something very, very mild. It may be something as minor as some ocular allergies, seasonal allergies, but it could be something much bigger and much larger, or could progress to something much larger very quickly. Any new discharge, so all of a sudden your dog's eye is tearing, or there's mucus discharge, those are something that needs to be brought to your vet's attention as well. Certainly any change in vision. So if you notice any, whether it be as extreme as bumping into objects, or just doesn't seem to catch like he used to, or seems to be more hesitant at night. Those are all issues that, if addressed early, it may change the eventual outcome. It may be something that escalates into something expensive, or it may be something that escalates into permanent irreversible blindness for your pet, or loss of eye even. The best example I have for that is a corneal ulcer. Just a loss of the outer layer of protective cells on the surface of the cornea. But that allows bacteria to take hold to the tissue underneath if the bacteria get there before those cells heal. Typically, an ulcer will heal in 24 to 72 hours. But if the bacteria find it and are able to take hold, that can then become an infected corneal ulcer that those bacteria eat away at the underlying tissue and eventually could lead to eye rupture. And this process I'm talking about can occur in as short as 12 hours.
What are other common conditions you see?
We see a lot of dry eye, especially in the spring. We see a lot of allergy-induced dry eye. Cataracts are very, very common.
Is that mainly when they get older?
You know, we can see it in any age. A large majority of cataracts in dogs are genetic in origin, and so they can be born with them. But certainly we see it more often in older dogs. Diabetes is a very common cause. More older dogs get diabetes than younger dogs, and so the majority of our cataract patients are older, but it can occur in any age, including birth. And then also we see glaucoma a lot. Glaucoma is an elevated pressure inside the eye.
What are the treatments like compared to what's available for people?
The majority of treatments that your ophthalmologist uses, we have those same availabilities for the most part. For corneal ulcers, oftentimes caught early enough, we're talking about antibiotics. I'd say the biggest change in technology, though, is cataract surgery and the equipment used to do that. I mean, it wasn't uncommon 15, 20 years ago for an ophthalmologist to do a cataract surgery and not put an artificial lens in, whereas today that's standard. The issue back then was rejection, and the technology has changed such that they've been able to use more inert materials and really make the lenses much less problematic.
As owners, what can we do to prevent eye disease?
A lot of the issues, like I talked about, are genetic in origin. And so I think if you're getting a bred dog from a breeder, certainly asking questions like, have the parents been cleared for congenital eye abnormalities or genetic eye abnormalities? Those are good questions to ask initially. There is a certification process for those dogs where they see a veterinary ophthalmologist yearly to screen for any abnormality that may be passed along genetically.
You know the story how my mom died in '07. One of her last requests: take good care of my dog Pippin. I brought Pippin to you in 2012. You did cataract surgery, changed her life. I wept when I saw her able to run again because she could see. What kind of things inspire you, Jeff?
The owner that comes in that tells me, this was my wife's dog and my wife passed away and this is my only link. Or my mom's dog. That owner's link to a loved one. Usually those are the ones that are going to do whatever it takes, whether they promise that person that they would or whether that's just what they're going to do. And those always inspire me. I had a long-term client call and say, I was at the post office yesterday and there was a nice lady there that had her dog with her in a pouch, kind of on her front, kind of like a kangaroo. And I noticed that the dog had some eye problem. Her eyes just didn't look normal. And I started talking with the lady, and I told her, you really should go see an ophthalmologist about that. And the lady explained that she didn't really have the money. Times were tough. The long-term client called us and said, "Hey, I am going to make an appointment for this patient, and I want to pay for her visits and her medication and whatever else she needs." People are good, and pets oftentimes bring out the best in us.
If a dog's eyesight cannot be saved, how hard is it for them to cope?
Those dogs do amazingly well. And I really think that dogs use their ears as their primary locating sense, and then they kind of fine tune things with their eyes. And then for things up close, oftentimes their nose is the primary sense. And so when you have three equal senses and you lose one, it's not quite as dramatic.
Things I've always wanted to know. How does my dog see the world compared to how I see it?
Dogs see very similarly to people with red-green color blindness. Therefore, most of the things that they see in the environment are shades of blues and yellows.
Now, Jeff, get this. That's my Juliet and Lily watching television. I hear that some dogs can see TV and some can't because of differences in how many pictures per second their eye is capable of seeing.
Some dogs can see TV quite a bit better than other dogs. It's all based on a concept called flicker fusion. Moving images flicker at a certain wavelength.
Frames per second.
Yeah, frames per second. And so that's what determines if a particular dog can see TV or not.
From your standpoint, what makes a good veterinarian, whether it's an eye doctor, some other specialty, or a primary care vet?
For me, that comes from a command in the Bible. Whatever you do, do it with excellence. It's been ingrained in me to have this love for animals since I was a tiny tot. I always set myself back to 2010 when I was sitting in a chair and found out that my oldest son had a congenital heart defect that would need surgery as soon as he was born. I try to put myself back in that chair talking with my clients.
Jeff, thanks for your time and a lot of great info.
You're welcome. You're welcome.
Next time on Dog Dynasty, Wendy Francisco, who wrote and sings God and Dog, an anthem for dogs. We use some of it at the end of this broadcast. Until then, woof.
God thought up and made the dog. Dog reflects a part of God. I've seen love from both sides now. It's everywhere.